I can tell you that my patients are not going to go home and appreciate the fact that the distal marginal ridge of tooth number 1-5 has a good occlusal contact in a finished case. Nobody cares about that. They're just not going to know that. They're going to know, how was the 2 years spent? Did I matter? Did they try to have some kind of a connection with me? And I think in order to establish those kinds of connections, we have to be genuine. And genuine is, I mean, there's social norms we all have to go through. You know, and everybody does this, you know, like, you know when somebody's giving you a fake hug, right? When somebody's like, thank you, like that. You know, I mean, this is what happens all the time. So we go through these motions, but that's not what being genuine is. The idea of treating people is that they feel you genuinely care for them. And this is where the Starbucks story come in. One of the books I would recommend people read if you have time. It's called The Starbucks Experience, and it talks about, you know, why people keep going back to Starbucks, because really it's more than coffee. And the reason why I bought the book is because I look at my receipts at the end of the year, it's like $3,000, $2,000 spent on Starbucks. Like, what? Like, is anybody else in the room in that boat? Like, yeah. So why do we keep going back? Because it's more than just coffee. And so, you know, if you keep going back to the same one over time, these people, they get to know you. And, you know, Ophelia knows I take soy milk, so I don't have to order at the front anymore. And it's just, you have a sense of belonging. So how do we translate, and what does this mean in terms of dental practice? Well, being genuine, of course, means that we have to always be attuned to verbal and nonverbal clues. Patients are not always going to tell us what the problem actually is. They're going to think that it's implied that we understand, but we have to look for what they're really trying to tell us but not telling us. Most importantly, we have to be genuine communicators. And so this means that we have to try and connect with the patient. We need to discover the patient. So the idea is to see the person behind the tooth. It's not just teeth, it's a human being. And then we respond based on what we discovered. And really, in order to accomplish these goals, we have to have a passion for caring. If you wake up every morning and you don't have a passion for what you do and you're just going through the motions, you know, fixing up your hair and putting on makeup and just doing it because it's Monday morning, I mean, we all have those days, but those are not the days you want. You want to be passionate about what you do.